My name is Catarina. I'm a carer for my daughter, who's ME/CFS for the last 4 or 5 years. Previous to that, she's had other comorbidities, but COVID brought ME/CFS. And I would then like to present Sian Leary. Did I say it correctly? Is it Sian Leary? Is it correctly? Did I say correctly? Sian Leary. Is she here? She's joining us online. Oh, she's joining online. Okay, sorry. Sian Leary is these are notes from Joan, professional expertise in different roles in ME's advocacy and research, and is also a member of Active ME. May I ask you then to introduce yourself further, and thank you for joining us. Is Sian there?
Yes. Talking to you today about patient and public involvement in research, or PPI. This refers to the active involvement of patients and the public in shaping research, ensuring it reflects real-world experience and that it meets real-world needs. I'm a member of the DecodeME Genetics Study Patient and Public Involvement Steering Group, and I coordinate PPI for a new project called PRIME, a research infrastructure building project for ME. I also live with ME myself. That dual perspective, both as someone with ME and as someone working professionally in the charity and research sectors, has shaped how I approach involvement. And it's shown me just how powerful it can be when done well. So I want to share how DecodeME built a gold standard model for patient and public involvement, PPI, and how we're building on that through PRIME. For those who don't know, DecodeME is the world's largest study of ME/CFS. We've collected over 18,000 DNA samples and already identified 8 genetic signals that influence the likelihood of developing the illness. This is a huge step forward for ME research and gives us so many clues on what to investigate next. It has also been incredibly validating for people with ME, many of whom have battled stigma and denial of their experiences since getting ill. But DecodeME isn't just a scientific and social achievement. It's a model for how we embed lived experience into research in a way that improves impact and scientific quality. DecodeME has been a huge collaboration. We have researchers, teams that deliver specific aspects of the study, communications experts, and people with ME all working side by side. Our PPI steering group is embedded in the project's governance. Everything from press releases to the ethics application to the risk register was reviewed by the steering group, meaning our experiential knowledge formed a key lens through which every deliverable was passed. Members from this group sat on each of the other teams and were conduits for information and decision-making. We weren't just consulted, we were part of the decision-making. And when capacity fluctuated, as it often does with ME, we adapted. We brought in additional contributors or had PPI steering group members join additional teams to ensure that continuity. That flexibility there was key. It meant that we could maintain momentum without compromising accessibility or inclusion. And I know for me, being able to pass the baton on to trusted PPI colleagues during periods of worse health was incredibly reassuring. So what does accessible involvement actually look like? Most of our meetings happened online. Meeting times, durations, and formats were all shaped around the needs of each group's PPI members. Some team members met for just 30 minutes at a time, others for an hour or more. Where people struggled with light sensitivity, staff made presentations with dark backgrounds, and they were always open to different methods of communication, be that emails, Teams, phone calls, whatever worked for the individual. We shared agendas and documents well in advance to help PPI members pace their energy and involvement, and we co-created timelines. I'm not alone in having attended meetings from my bed on crushy days, and I was never made to feel my involvement was lesser because of that. Plus, we tried to ensure involvement didn't need to be all or nothing. This wasn't always easy for the individual. Some of us pushed past our limits because we were so invested in the project, but the principle that people could step back and rejoin as their health allowed was always upheld. One of our biggest contributions was developing the participant information documents and the DecodeME questionnaire. We tested all these documents with small groups of people with ME, made changes based on their feedback, and saw a 20% increase in correctly completed postal questionnaires because of this. That's a direct impact on data quality driven by PPI. We also helped shape how DecodeME supported its participants. PPI contributors wrote sensitive, thoughtful responses to common queries from participants. And when more complex questions came up, we worked with staff to craft responses that reflected the experience of ME. This made the study more responsive, more human, and built impressive levels of trust with the community, enabling us to build a big enough cohort of participants to power our analyses and find the genetic signals that we have. And our involvement didn't just stop at design. We were active in delivery too. PPI members helped create a video guide for returning DNA spit kits and edited our outward communications for accessibility. We also co-hosted webinars with researchers that reached tens of thousands of people. This wasn't just about inclusion for the sake of it. It was about impact, and it worked. This is what true involvement looks like. Not tokenism, not consultation after the fact. Our principal investigator, Chris, devolved decision-making. Together, we embedded PPI in governments. We budgeted for contributor fees, and we created space for people with ME to shape the research from the inside. Personally, I've gained so much from co-producing DecodeME. It's helped me grow, supported my career, and given me friendships and connections that I truly cherish. And it was meaningful for staff too. One team member told us, "This is the most fulfilling role I've ever had." DecodeME is still analysing data, and PPI members will be co-authors on future publications, including one on PPI itself. But we're also building on this model through PRIME, a new UK Medical Research Council funded project to strengthen ME research infrastructure. PRIME has three main aims. The first is creating at least 15 new research collaborations to coordinate and engage researchers over the next 4 years. The second aim is to build 2 international consortia, one focused on genetics and the other on molecular biomarkers. And thirdly, I am hugely excited to now be working for PRIME to create the world's first large-scale pool of PPI contributors for ME research. At least 100 people with experience of ME, either as patients or carers, trained and ready to co-produce research. And it means that future ME research can be shaped from inception by people who truly understand what it's like to live with this illness. This is all about making meaningful involvement easier, faster, and more effective for researchers, while ensuring that research stays grounded in real-world experience. As many of you already know, the ME community is full of brilliant minds. Faced with a lack of care and treatments, many of us have extensively read the research literature around ME, trying mostly in vain to find something that could help us. Some of us are trained scientists, others just geeky lay people. But whatever our background, our experience of ME gives us a vital role to play in research. And when we involve people meaningfully, we don't just improve the research, we accelerate the search for treatments and one day a cure. In time, PRIME will be actively recruiting researchers and industry partners to join our network and members of the public to join our PPI pool. So keep your eyes peeled. There will be new opportunities to collaborate just around the corner. Thank you.
Can I call Leticia then? Right, then our next presentation is from Leticia Soares. She's a biologist on the Patient-Led Research Collaborative. And she's a trained biologist with background in infectious disease, ecology, evolution, epidemiology. And she co-leads Patient-Led Research Collaborative research and coordinates with external partners in academia, industry, and government agencies. She also has low COVID since 2020.
I'm one of the co-leads of the Patient-Led Research Collaborative, and I will be talking about benefits, challenges, and recommendations of incorporating patient representatives in research. So the Patient-Led Research Collaborative, it's an interdisciplinary group of people with long COVID and associated conditions with expertise in the sciences, technology, policy, and media. We are about 50 people, both patient researchers and advocates, and we are located across 5 continents. And since we began doing this work in April 2020, we have authored or co-authored more than 40 papers in the field of long COVID. Our mission is to improve the breadth, depth, and speed of global research into long COVID and associated conditions, and to advocate for policies that improve the quality of life for long COVID patients worldwide. So what is the role of a patient researcher? Patient researchers combine domain and lived experience expertise. They bridge knowledge gaps, they ensure the relevance of research design, address equity issues in research, and contextualize and translate research findings. There are several key benefits of embedding patient participation and patient engagement in research. The main one is study design and questions that reflect disease heterogeneity and lived experience. And this is very important in the context of infection-associated chronic conditions in general. And when patients are embedded meaningfully in the research process, we do see a higher impact and efficiency of research because research priorities match patient needs. Other key benefits include lower odds of iatrogenic harm in clinical studies. So considerations to prevent PEM and CAS, for example, are often overlooked, and yet they are essential. So patients are not harmed when they participate in research studies, and that's something that we often point out, like how to improve and how to prevent PEM and other potentially harmful events that can happen in participation. Participation enables accurate representation of the disease experience. For example, inclusion of symptoms that drastically affect patients' quality of life. For instance, PEM, which is to this date is not included or considered in several long COVID studies, like including clinical trials. And another example are symptoms associated with the menstrual cycle. And the patient engagement can enable improvements in inclusion and diversity. For example, our work in the project in collaboration with the Osvaldo Cruz Foundation in Rio, we helped adapt the wording of the symptom survey that reflected both patient experience and enable participation of people with low socioeconomic backgrounds in this study. But there are several challenges, and based on what we have learned so far, we know that patient researchers, when you embed people with expertise and lived experience expertise into the research process, there is this challenging of assumptions of who should produce knowledge, and we are constantly in attrition with hierarchies of power dynamics. So you can expect a disagreement, which is often healthy. And one recommendation to make this process smooth is to plan for shared decision making, to really have a model of governance that acknowledges that, and a mediator in the team to help with conflict resolution and consensus can really help. Another challenge is a lack of or insufficient planning of patient engagement. So patients often are brought in after the project begun, constraints the input that patients can offer. So for example, if you bring in patients after you submit your IRB, it's very likely that you're gonna have to amend your IRB because of suggestions that patient researchers make. And one recommendation to make this process more efficient is to co-create and co-develop projects with patients and have an engagement plan. And we developed a tool to guide and evaluate that, which are the patient-led research scorecards, and we encourage researchers to use that. Another challenge is fair compensation plan for patient researchers. So please do consider this as labor because it is, and researchers need to budget accordingly for this collaboration with patients and also be upfront with patients about what budget they have to support the type of work that they are expecting. Another challenge is accessibility of participation, which is often it's a problem in academia, and it's often an afterthought that hinders patient participation. And biggest recommendation here is to put accessibility at the forefront. Consider access needs specific of the patient population and flexibility in the modes of participation. For instance, some patients don't tolerate long meetings or even video calls, So make sure that there are opportunities for these patients to provide input into the project. Finally, one challenge are triggers, trauma, and how this work affects the mental health of the patient researchers. Because often we are facing triggering situations and interactions, and we have to advocate against practices that have harmed the patient community, including ourselves. And one recommendation is just, this should be really the bare minimum, is to familiarize yourself with the history of infection-associated chronic conditions, especially in ECFS, and do not repeat the same mistakes. And another thing that you can provide to patients is have multiple patients in the team and have a support system. So for example, in our group, we have a dedicated Slack channel for specific support in research participation, where we can share the challenges that we have been facing with this type of work. I would like to thank you so much for listening, and I would take this opportunity to invite everyone to join our registry. And if you have any questions or comments, please feel free to reach out. Thank you so much.
Good afternoon. Thank you for the presentations. And hi, Sean as well. How are you today? Can't hear you. Leticia, also we not hearing you.
We can hear each other.
Yeah?
Yes.
Who can hear
I
you now?
think they cannot hear us there.
Okay. We have a question for Sean. How do we sign up for Prime PPI? And for those that don't know, what is PPI? For people that are watching us for the first time.
Okay, can you hear me now?
Yes.
Fabulous. So yeah, it's a joy to be here. Thank you so much. For Prime PPI, we don't have a way of signing up yet. I'll just be upfront about that. We are in the very, first month of this project, and so that's something that we are going to talk through. We've got a few PPI members who are already involved, and I should start with the other question. What is PPI? Patient and public involvement. So what both I and Leticia have just been speaking about. But yeah, in terms of Prime, we've got a few PPI, patient and public involvement team members who are going to be working with me to develop all of the recruitment processes for the pool that we're creating, so that we try and make those as accessible as possible, and so that we kind of run the project with that patient experience at its heart from the get-go. So we would love people to keep an eye out for those opportunities to join us in the future, but there isn't a way to register your interest just yet.
Thank you. Leticia, I have a question. Any questions on? She'll come to you now.
Good afternoon. My name is Diana Vieira. I'm a patient, a psychologist, and an academic. So I was diagnosed 3 months ago, and I have been ill for 3 years. And one thing that I thought you were going to talk about, because I was very looking forward to this panel, is as a patient, it's very difficult to find doctors that understand us and so on, and we have been talking about that. But there are other things that I think is most important, that is, what can I do as a person that is ill with this syndrome? And people tell me, oh, do pacing, manage your energy. I say, but how? And I think
We've just lost you online, so we're not hearing the question right now.
so. Do you have resources for the patients to understand how can we do pacing? Where are the people that have the similar symptoms as I do? Because I already belong to this Portuguese association, but I can see that people are so different from me that so the support, social support is very important for our health, not only physical, but also mental. So as patients too, I was expecting you to give some guidance. I know this is a medical conference, but without us, they will not be here.
Thank you so much. Sean, do you want to go first? Or?
Go for it, you go.
Yeah, I appreciate that question a lot. I think that is definitely a challenge for all patients to find resources that are evidence-based and are trusted in our community. Internally, we have collaborated with organizations like MEAC, who developed a pacing guide, and so we have developed, co-developed with them a pacing guide for clinicians, exactly following this idea that sometimes, the clinician is not familiar with patient, and the patient needs to bring that resource that is geared to clinicians. But the resource is also accessible to patients, and ME Action also has this resource specifically for patients. At Patient-Led, we are also, this year we have been collaborating with Rhythm to develop a guide of possible pharmacological interventions for people with long COVID, and that encompasses, things like what are the treatment options, right? Because a lot of times we're told that, oh, I really, I have empathy and I understand what you're going through, but there is nothing I can do for you, which is not true. There are options there for symptom management and things that have been used, especially in ME care, for such a long time. And we really need to harness that knowledge and put it out there. So hopefully we will be releasing this resource this year still, and we're also going to be translating it. And the pacing guide is also translated to Portuguese, Spanish, and French.
Brilliant. I think a great answer from Leticia. I think I would add to that prior to my work with Prime, I was working with an organization called the World ME Alliance, and we have recently kind of published a pilot version of an online medical education hub. Now, technically, it's aimed more at health professionals than it is at patients, but I think it also kind of directs patients to some of the best resources that are already available out there, and what resources there are in different languages to speak more about, how to live day to day with this illness, because it's not easy. And yeah, I think there's other resources you can go and find through the World ME Alliance website, including a resource on how to involve people with ME and other energy-limiting chronic illnesses in research. That's a good one. But also, it just directs you to who your national charities are working around this illness, and I think that's a good way to reach out and find that support in your own language, in your own country. And I think you're absolutely right to say that social support is a big part of what is needed for people with ME, especially when there are treatment options, and yet we also still have to live with very significant symptoms with this illness. So it's all part and parcel of trying to do the best we can with our current knowledge levels.
If I might, Malena Marafati unfortunately wasn't able to join us. She was the third panelist today. There was a very important Audiencia Federal in Brazil yesterday at the federal level to discuss the new fibromyalgia and chronic fatigue law. So she's just overwhelmed. But Malena would have spoken about the focus groups that we've done. Malena coordinates a focus group in Brazil with long-term ME and long COVID patients with over 6,000 patients And we also have a support group here in Portugal with people that had been living with this illness for 10, 20, 30, and 40 years. So a lot of the experience in terms of where the publication meets the realistic application of these techniques resides in the cumulative experience of these patient activists. And you're welcome to join us. The group is professionally moderated by Melina, who is a former oral maxillofacial surgeon, a highly trained academic clinician, and someone who's been living with ME for 30 years. It's moderated around the clock. It's open 24 hours. It might take you a couple of hours to respond, but a lot of the patients in the group, because of insomnia and because we have Brazilian patients, will chime in 7 days a week, 365 days a year. So we do have that structure in place, and so please join us. So just
Can I add one more thing about support groups? I don't know if you can hear me.
Yes, we can.
Oh, okay, good. Yeah, I want to highlight the importance of that, and I think from my personal experience, it has been, especially, I also had a very delayed process of diagnosis, including of ME and of POTS. It took me literally 5 years to get a diagnosis. And in the meantime, I think what has saved me, I say has saved my life, was the knowledge of patients, and patients who were in this fight before us, like ME patients especially. So I extend like a lot of gratitude to them. And for folks in the US, if you are in need of a support group, please reach out. There is a Discord support group. It's not moderated by us, it's moderated by a different group of patients, but we can send you an invite. So reaching out and trying to find support groups is definitely something very important.
I just want to add to that, a simple resource you can access is at the Workwell Foundation. That's all one word, workwellfoundation.org. It's in English, but they have very accessible resources about pacing and what is post-exertional malaise. You go to their website. There's some video clips there, but one of the things that that you can begin to use as a guideline for pacing is your resting heart rate plus 15, and try to live under that heart rate until you get a 2-day exercise test where they can tell you more specifically about your heart rate guideline. But if you don't have that, it's fine. Use your resting heart rate plus 15 as a guideline to try to stay under a heart rate that will exacerbate symptoms. And I'm speaking tomorrow about the 2-day exercise test, so feel free to pepper with questions at that time too.
I would just add for everyone who's worldwide watching us, look for Facebook, Reddit, Discord groups that are the diseases that you have, and you will find that patients who have it for a long time, they will have resources for you, and they'll share practical, not all necessarily science-based, but they have practical experience, and that, again, we spoke earlier, has value. So we'll find there. There's lots of patients with self-resources, and they will guide you to associations in each country, and they will guide you to doctors that understand the condition. They might not have all the answers, but at least they'll not be dismissive of you. And that is a help because you are in a group and not being dismissed. I have a question from a viewer. Is there a wish list, a priority list of topics that the patient researchers think should be research or research strategy more generally? For one of you or both of you.
I'll start off with this one. So a few years ago in the UK, at least, there was a project called the Priority Setting Partnership, run by an organisation called the James Lind Alliance. And they've run these partnerships in quite a few other disease areas and were able to do one in ME. I was fortunate enough to be on the steering group for that project. And so through a kind of elongated process, we went out to kind of multiple rounds of survey for people in the UK who either have the disease or are carers for people with the disease or are healthcare professionals working with people with the disease to suggest research topics around the illness, and then to kind of go through a process of voting for which ones were the most important. And we came up with a top 10 plus, because there was actually 11, a top 10 plus research priorities in ME/CFS that have been developed by people with ME, carers and healthcare professionals. So you can look for that by searching Priority Setting Partnership ME/CFS or psp-me.co.uk. I think it's a really useful resource for directing future research. In the UK, at least, it will be used for, if people put in funding bids related to those top 10 priorities, they will be prioritised by some of our major research funders here in the UK. It's very much a patient-led project and approach again. So it was a really good one to be involved in. Recommend go looking up those top 10 ME/CFS priorities.
Thank you. Leticia?
Yeah, I think on the long COVID side, we have been really trying to push forward for clinical trials and investment also in research that can support clinical trials, like development and standardization of outcomes. And I think here we really need to think forward to a scenario where we want to have global clinical trials and we want to have outcomes that can be applied to different populations, different languages, cultural contexts. And right now we don't have that. And there is very little funding that is allocated specific to this work. It's not very glamorous to develop outcomes, but we are in very, very high need of that. And just in general, in terms of just clinical trials for pharmacological interventions specifically. And I think on the side of the pathophysiology, would love to see more research on the pathophysiology of PEM. That's just very needed on all, just an overview of that. And on the structural associations, that we have been developing, like all the connections between CCI and our symptoms and manifestations.
I can just add up. I've gone to the website to remind myself what those top priorities are, and there's a huge amount of overlap with what Leticia has just said. So it's good to see that alignment, but very much the priority one is post-exertional malaise and trying to better understand that. And priority two is talking about existing drugs that can be repurposed to treat ME/CFS. And I think, it's good to hear Leticia talk about kind of those outcome measures. And I know that we want to see clinical trials, but we want to see them done well and in a way that can be replicated and that we can really rely on so that patients get the information that they need.
Thank you. Thank you for your participation. Thank you for all the work you do. And have a rest of a good week. We're going to then break now for a 10-minute, 15-minute coffee break, and then we'll restart in 15 minutes then.